Hello, everybody. Thank you so much for joining me. This is Juliet on Inspiring Time with Juliet, streaming live here on voiceafricaradio.com. I hope you're doing well. It is absolutely wonderful here in England, and where I am at the moment as well is a little bit cloudy, but it is absolutely wonderful. The weather is good. I don't know how you are, where you are. You can just drop me a line. And welcome again, once again, on Inspiring Time with Juliet. We have a wonderful topic, and it is menopause. It is my very good subject, something that I've researched on. I know quite a little bit about menopause, and I'm welcoming you here today so that we can just kind of talk about it. Okay, don't be shy, and feel free, just drop me a line. And also just say, let me know how you're feeling and also how we can help you. Ask those questions, throw it, and then I'll try and answer it as much as I can. And if I can't answer your question, I'll come back maybe next week and answer them or drop you a line later on. So menopause, what is menopause? You might have heard about menopause several times. You must have heard it from your mom, from your family or from a colleague, or you might have had it from work, or you might have had it from maybe in a bus, people talking about it, even people joking about what menopause is. So what is menopause? Okay, so let's start from there. I did make, another show some time ago about menopause, where I explained what menopause was. I defined what menopause was, and also looked at the understanding and the myths that people have behind menopause. I tried to debunk them. Today, we're not going to look at menopause and those things anymore. Today, we're going to concentrate solely on the symptoms. So what is menopause? Menopause is a point in time after 12 months of you having your period, when your period stopped. That's basically what it is. When your period stopped, 12 months from that period when your period have stopped occurring. So by this time, it's some hormones. There are hormonal changes. We have the two hormones that are responsible for reproduction. We have the estrogen and we have the progesterone. So those hormones begin to reduce. Okay. So when those hormones begin to reduce, it brings about symptoms. Okay. You look at it as early menopause. You look at it as late. You look at it as symptoms of menopause. So we're going to be looking at those symptoms. There's so many of them. We can try and go through each one of them as much as we can. Like I said, just tune in, just drop us a line, ask me questions, and I will try as much as I can to answer those questions. Before we move on, before we look at those symptoms, let's just try and look at a little video clip that I want you to, watch, think about it, and we kind of go through it and discuss it when we come back. So watch this video now.
Women's Club going strong with 37.5 million members and over 6,000 more joining every day. Grab your fans, ladies, because I'm talking about menopause. Now, my next guest, Jeannie, says she's living in menopause hell and wants to know when her membership expires. Take a look.
Menopause is PMS 24/7. One of the biggest symptoms is hot flashes. I'll just break out in sweats. I could be sitting still and I will be drenched. I'll grab whatever I can to fan myself. My shirt's always the handiest thing. My 5-year-old granddaughter noticed that I was all sweaty. My hair was up and she said, "Grandma, I gotta go get you a wet cloth and wipe you down." I can't remember anything. My husband likes to call it mental pause. I like to exercise, but no matter what I do, no matter what I eat, I can't lose weight. I am a newlywed.
We've only been married 2 months.
Joe and I have a really good relationship, but I think it's frustrating for him that he can't hold me because I just get too hot and I have to push him away. As far as my sex drive, it's not what it used to be.
Well, Jeannie is very self-conscious about the subject, and she has repeatedly said, "It's not you, it's me." It can be inconvenient and at times annoying.
This whole thing with menopause is just making me absolutely crazy. Sometimes I feel like I'm overreacting, but it really is that bad. Dr. Phil, do you think I'm a drama queen? Do you think I'm overreacting?
I don't know if you laughed at that lady from that video clip. Welcome. This is Inspiring Time with Juliet, and we are talking about menopause. And not just menopause, we're looking at the symptoms of menopause. A lot of people joke about it, they laugh, about menopause, and they sometimes kind of misunderstand what the symptoms are. So what are the symptoms of menopause? If you do know any of them, just drop me a line and we can just say it as we go along as well. So what are the symptoms of menopause? Okay, so I just want to, before I begin to explain what the symptoms are, I wanted to let you know what the early menopause, what the causes of early menopause could be. We have hereditary. Okay, if it runs in your family, or if you have a surgery, some people have their womb taken out, earlier on, or some ovary taken out earlier on in their life or something, and because of that, they go into menopause, early menopause. It's people that have surgery. Smoking, believe it or not, can cause early menopause as well, because it's even secondary smoking. If you are, in the same place, or if you are always inhaling the smoke, it will also lead to early menopause. Underweight, people that are underweight have a high risk of going into early menopause. If you have cancer, because of the cancer cells, because of the abnormality of the cancer cells, it just kind of make it also a high risk for people to have, to go into early menopause. Epilepsy, when people have seizures, it can cause the hormone imbalance in the body as well. And because of that, the hormones are, kind of affected, and people can go into early menopause. So, and those that have what we call polycystic ovarian syndrome, the POCS, because at this people that have this kind of condition have reduced hormone, and because they do, it affects the hormone imbalance in the body, and they can go into early menopause. Okay, so what are the signs of menopause? Okay, what are the signs? What would you be looking at if you feel that you're going into menopause? What are those signs? One of the signs that is quite obvious for any woman, okay, including myself, is that you will not have any period. Okay, some people won't have period. No, not if people will not have period. You will not notice period anymore, and this is why you're saying, okay, I'm now in my menopausal years. Okay, mood swing is another big one. So okay, so you are happy one time, you are not happy, little things just irritate you, you're not quite stable in your mindset, and those things is menopause. Is one of the signs. Okay, so if you're joining me, let me know what you think are the signs of menopause. Okay, so I've mentioned no periods. You don't see any period. Thank you, Lillian, for joining me. Lillian said hot and cold flushes. Obviously, yes, that's the big one. Everyone complains of hot flushes and cold flushes. Mostly people notice it at night time. You can't sleep, you can't settle. When you are at work, it's just so embarrassing. You just kind of feel a sudden hot flush in your body. That is one of the signs of menopause as well. Okay, so and a lot of people, from my research, because I did some research regarding this, and a lot of people do complain of hot flushes more than anything else that I'm going to be explaining to you today. So weight gain is another thing. Obviously, people are going into old age, believe it or not, because menopause starts from the age of 45 to 55. And for the black woman, it actually kind of comes later for us, which is really, really good. Okay, so the black women have been found from my research that they actually start experiencing menopause much later than their other counterparts. So what are the other symptoms? And Lexi Ayo says irritation. Absolutely, you are so irritated, you can't settle down. You're so kind of want to go out, and when you go out, you want to come in again. You are, if people say things a little bit, that is so annoying, you kind of flare up. Yes, you're so irritated. So if it affects your mood, that's one of the symptoms of menopause. There's another one. The skin becomes thinner. Okay, people notice in their menopausal years, that their skin becomes quite thin. And that can lead to skin problems like itchiness, scratchiness. And you see some people, they're scratching all the time. And that is why when you have to start using moisturizers, okay, start using some complements, okay, supplements as well. Use moisturizers on your skin. Make sure that you're not going out with without any skin moisturizer. People get irritated, their skin is affected, and they get itchy skin and they're scratching all the time. Now let's go back to hot flushes, because when you have hot flushes, you're sweaty a little bit as well. You get so sweaty, and during this time people begin to have some kind of odor. Some women has been found to have sweet odors during that time, and some have odors that are not quite good. Okay, so this is the reason why when you are in that transition age, make sure that you're looking after yourself. This is what this show is all about, to be able to educate us, to be able to create that awareness that this can happen. And it's not really a bad thing, to be quite honest. To be going through menopause is not a bad thing. It's actually a good thing. I am looking forward to going through mine, because it's something that you can pass on. You can say, okay, I went through this and this is what happened to me, and this is how I can actually go about doing what I can do to help myself. So menopause, symptoms of menopause. We're talking about hot flushes, we're talking about irritation, we're talking about itchy skin, scratchy skin. And also, don't forget that people at this time of their life, they begin to be forgetful. Don't mistake it to a normal forgetfulness that we do have. But when it's actually out of hand, that is occurring all the time, then you know that there is a problem there. Memory lapse. They forget things. Okay, if they kept a key there, they can remember that they left the key there. They just be looking for the key all over the place. If that's happening to you, if you can't remember things anymore, you can't remember where you kept things anymore, you can't remember what you've written down or what you've done before, the day before, it is time to actually start to seek help. Now, there's another embarrassing thing that happened during the menopausal phase, is incontinence. You find out when you laugh a little bit harder, you can just urinate, on yourself. And it's not, there's nothing wrong with you. It's just that you're going through this transition stage of your life. So that can happen, especially when you cough. If you do cough and it happens, don't worry. Make sure that you get your sanitary pad, make sure that you're covering yourself and you're ready, and you are making sure that you're keeping clean within yourself. And that could happen, and it is not a bad thing. Okay, so we've been talking about menopause, and we've been talking about the symptoms of menopause. I just want to recognize Lexi Ayo for joining me. Erin, thank you for joining. Erin says body and hair. Yes, people's hair begin to fall out. Some women's hair begin to fall out. It's not a strange thing. It's not because you've got a strange thing happen to you, whatever. It is because you might be going through menopause. So hair fall out, and some people, they have the opposite as well. The hair becomes fuller. Some research have found that some people's hair becomes fuller, but people's mostly their hair fall out. Lexi says that brittle nails. Yes, people's nails begin to be quite brittle. Okay, it's not as strong as it is, and you find out that you're going to that nail shop to do your nails, but it doesn't last long anymore. So it is one of the symptoms. Irritation, hot flushes. Yes, irritation, and bloated tummy. Yes, bloated tummy is one of the symptoms of menopause. People have reported to have menopause. When I did research a few years ago and I interviewed some women from the black community, a lady said to me, that I've been getting these cramps on my leg. That was one of the symptoms that was reported. I didn't really kind of understand it or see the connotation between the cramps that she was getting. I was thinking of something different. Now I had to go back, read about cramps and everything, and lo and behold, it is one of the symptoms of menopause, So cramps, because the muscles, they ache a bit more. They're not relaxing because obviously the hormones are reduced. They're not working as well as they used to, and because it's not replaced, it can cause cramps, achiness, muscle stiffness. That is why when you're going through menopause or during the period that you are going through menopause, try and exercise. Make sure that you're stretching, you're exercising, and you're trying to make sure that you are also having some calcium medication. Just have some, some supplement. See your GP if you're not quite sure how to go about it or what is going on. If you are in menopause or not, see your GP. That's one of the things that you can do during menopause. Okay, thank you so much. Erin says, what is the average age to reach menopause? From my first show, we did say that when you are between the age of 45 to 55, that is when menopausal symptoms begin to occur. Now, some women have it much later. Some women don't even have any symptoms at all, and some women have it so bad. So, and there are some factors that could cause this. That could be, there are some factors. Some factors are hereditary factors. Some factors is because you're so busy. There are things that are happening in your life you don't even notice that you're going through the symptoms. So, and also some of the factors is cultural. Most black women, some of them, from my research work, do not have the symptoms. Some of them don't, and some of them do. Okay, so this is what we find out. So it's from the age of 45 to 55 years old. And I'm going through some of the questions here. So I've answered that one. Digestive problems. Yes, digestive problems could be from bloating, stomach problems, irritation there, having stomach cramps, not being able to digest your food properly is one of the symptoms of menopause as well. Okay, so joint pains, I've mentioned it, pains, cramps, joint pains as well, achiness is also some of the symptoms of menopause. Okay, so I've got other ones as well that I would like to kind of raise here. Unexpected tears. You just kind of in the midst of a discussion or a meeting, you broke out in tears. Those tears begin to come down. There's a sign of of menopause, which leads me to depression. People that go through menopause, they have depression. They go through depression. That is why you have to really make sure that you're looking after yourself, not just physically, emotionally as well, because these things affect us all overall. Increased tension. Someone mentioned aches, joint aches. Increased tensions within the muscles, cramps is one of the symptoms. Difficulty concentrating. You can't concentrate. Maybe it's because because of the hot flushes that is going on, or maybe you're thinking about it so much. You're thinking about all these symptoms that I'm getting. What is it? How long am I gonna have it for? Like the lady in the video, how long is she gonna be in menopause for? So those things can actually make you. It can cause difficulty in concentrating, in concentration. Try and relax. Try and speak to other people. Read about it. Get yourself educated, and make sure that you're taking supplements. If you feel that you are not coping, see your GP. See your GP. Some women go through a period where they have dooms, things they begin to feel as if there's a big doom coming to them. They have a feeling of apprehension. Those are some of the symptoms of menopause as well. Fatigue. You feel tired. Those things that you used to do before, you can't do them because you're so tired. Those are some of the symptoms as well. Yes, some people have irregular period of bleeding. That's when they're going into pre-menopause. They can have that. Thank you, Ayoyinka. Rosemary, thank you so much. This is what happens during the time as well. Bloated tummy, we've kind of explained it. Loss of libido. Okay, this is where people kind of find it difficult. They can't, they don't have a feeling of having their partner anymore. It's not the same as when they're not in menopausal period. So partners should be able to be understanding. They should be able to be patient with their partners, with their wives, girlfriends, and things like that. So they should be able to just be patient with them and help them to cope with it, and also assist them to find methods to manage their symptoms. So we're going to just take a little bit of break in a minute, and when we come back, we continue with the symptoms. Symptoms are quite many. Some of them kind of overlap with the other, but there is help. And it's not gloom and doom. It's not a disease. It's a period. It's a transition. Always have it in the back of your mind that this period is going to end, and try and find ways of coping, how to manage it, which there are out there, and also try to use supplements. Make sure that you're looking after yourself, you are listening to your body, and when your body is not the way it's supposed to be, or when your body is speaking to you, almost always how you have to act and help your body to cope. So I'll be taking a minute now. When we come back, we just continue on the symptoms of menopause. Keep throwing your questions. Welcome again here on Inspiring Time with me, Juliet. Thank you for joining me. For everyone that has joined me this afternoon, we're talking about menopause, and we're looking at the symptoms of menopause today. Thank you, Ayoyinka. Thank you, Lexa. Thank you, Erin. There's somebody else. Erin. Yes. Okay, Erin, you just said that can lack of sex cause menopause? No, not really. Not having sex doesn't cause that. But it could be that when you are in a menopausal transition, you might not have the feeling anymore. And it doesn't cause it, but it's one of the things that will happen. Is one of the symptoms. You just have loss of interest in that area. I think it's because of everything else that is going on in your body. You're trying to cope. You're having hot flushes, sometimes cold flushes. You can't concentrate, forgetting things. Your interest changes, and it affects that area of our lives as well. He says, can you please confirm if lack of regular sex can cause menopause? It can't. It does not. Okay, but one of the symptoms of menopause as well is the area is very dry. Is quite dry. You have a general dryness. Which is because the hormones they are reduced. They're not keeping the area dry and moistured. And this is why you have vaginal dryness. Try and use things like moisturizers, things that's liquid things that can just keep the area nice and clean, nice and supple. But you have to always make sure that you're keeping the area clean and you're keeping yourself clean as well, and listen to what your body is saying. So some of the other symptoms of menopause is hair. People notice that they have a lot of hair, especially in their facial area. They have a lot of hair. And those hair can be quite thick, and could be unexpected. Body hairs, especially where the hairs appears normally in our body, begins to be quite full. So it's one of the things that happens during menopause. Okay, so I want to mention one particular thing as well that happens during menopause. Is the fact that you have excessive thinking that things are getting worse than they are. Okay, so little things are magnified. You feel that something that is little is now big. But you have to watch your mind. That is why you have to mind your mind. During this last few weeks, we've been talking about mental health. So mind your mind, because research have repeatedly shown that people that go through menopause, they have mental health symptoms, things like depression, and they go into anxiety, and they have panics, panic attacks and stuff like that. So this is a period that you have to really make sure that you're minding your mind, and you are looking after your mind. Okay, you are looking after not just your physical health, your mental health as well. Make sure that your mood is watched and your behavior is watched as well, and ask questions. Okay, if you know that you're not coping, just take a trip and see the GP, or you can ask experts as well. And there are some support groups as well that are around. I'm setting up a menopausal support group within the Northampton area, so watch out for that. You can just call anytime and just ask questions, and we'll be able to support you during this period of your life. Brittle bones, one of the symptoms. We did mention it briefly earlier, but brittle bones is one of the huge symptoms of menopause, because during this time the calcium level of your body is reduced, because obviously the hormones are no longer as they are, and so people suffer with what we call osteoporosis, and that's when you see people beginning to develop hunchbacks. When they bend down, quite like they'll be walking as if they have hunchback, and if you don't look after it, it gets worse and worse. People have achy joints. Their bones are brittle. They can, when they fall, it takes time for them to recover. They're prone to falling, because obviously the bones are not as healthy as they used to be. So these are the things that will happen. You must also make sure that you see your GP, because he can put you on some kind of tablets to be able to replenish that. But before you go into menopause, it is very important for us women to have some supplements. Make sure that you are looking after yourself. I can't stress it even more. Make sure that you're listening to what your body is saying. Okay, get some supplements. See your GP. Read, educate yourself, learn a bit more about what is going on, what is happening to you. Okay. So yes, we did mention night sweat. Thank you very much. Lexi is one of the things that happens, and is the hot flushes that we're talking about. And that takes me to one of the symptoms that people can't sleep very well during menopause. That's one of the symptoms that's been reported: lack of sleep, or reduced sleep, or not really resting. What do? Make sure that your windows are a little bit open, and make sure that you are, that there is the room where you are in is cool, and you're not covering yourself with a lot of duvets, a lot of, clothes, and wear something light all the time. Just make sure that during that time that you're wearing something light, so that, when the hot flushes comes, you don't sweat it all out. So we're just talking about menopause today. Symptoms. Are you going through it? Do you have someone that that is going through menopause? Is there any story that you want to tell us out there? I've had so many stories, because I've been researching about this topic for quite a long time. So I've had so many stories, and each time I hear it is absolutely amazing. And I want to kind of appreciate women that are going through this period of time, and they're coping really well, together with all the things that is going on in their life. People that are have children, children are leaving home, their parents are actually kind of ill now, and they are running around trying to look after both their parents and themselves as well. People go through bereavement during this period of time. People at this time, maybe they have lost their job, they're relying on people, and so they're going through traumatic life experiences during menopause, as well as the symptoms. I just want to say, it's not all bad. Just relax, take one step at a time, and look after yourself, and listen to what your body is saying. If you have any problems, if you have any question, you know who to ask. Go to your GP. I am setting up a support group as well on menopause that you can ring in, and you can actually kind of ask me any question. If I'm not there, somebody else will pick up the phone as well. So continuing on the symptoms of menopause, like I said to you, there's so many that has been reported out there. One of them is lightheadedness as well. lightheadedness. People feel lightheaded, as if they are dizzy, and they keep asking them, so what is going on? They feel something strange is happening to them. First of all, go and see your GP so that your blood pressure can be measured, just to make sure that you're okay. Blood pressure is not playing up as well, and if it is playing up, that it is monitored as well. So lightheadedness, headaches, dizziness is one of the symptoms as well. Thank you, Ayoba. You did say to us, what age does menopause start? We did answer that question earlier. I think you're just joining us. It starts from the age of 45 to 55 years old for women, for a normal menopause to start. But some people have early menopause, and we did say that early menopause can be caused by hereditary, heredity. It could be the genes, it could be cancer, it could be seizures. People that have epilepsy, they can have early menopause as well because of the hormone imbalance that is occurring during that time. If you are underweight, you are in a high risk as well. So people that suffer with polycystic ovarian syndrome do suffer with early menopause as well. Smoking is a huge factor. So please, if you do smoke, try and see if you can stop smoking, because it is one of the factors that actually lead to early menopause as well. Okay, surgery for those that have had surgeries to remove either their womb or to remove ovary, they can have early menopause as well. They can have those symptoms. Thank you. She says, okay, thank you so much. So we're continue on menopause and the symptoms of menopause. Okay, so I want to mention another symptoms that is quite rare. People don't really mention that, they don't really know that that's one of the symptoms as well. Is the ringing in the ear. That's been reported recently. That's the ringing, when people kind of hearing rings in their in their ear. They call it tinnitus. So people go through that. We don't know why, but we are blaming it on the hormones as well. So because the hormones are reduced and because it's not functioning as much as it used to, is now bringing all the symptoms about for the women, which is unfortunate. But there is help out there. If you are going through that and you have one of those symptoms, make sure that you see someone medically trained, specialist that can also go through that with you and see if they can put you on some kind of tablet or not. Okay, so medically, how come women who are already in their menopause age, like 60 years, still give birth? We don't know. we don't know, but what we know is that sometimes it could be artificially inseminated. It could be something that is done artificially. We're talking about natural menopause here. Okay, so if they are in their 60s and they're still giving birth, it could be a miracle. It could be that they were assisted artificially to have babies, and every individual is different as well. Even though we are all classified as a group, some people have miracles happen to them. We don't underestimate the handwork of God. So okay, so Ayoba, I hope that answers your question. So fingernails cracks and break easily. Okay, so those are the symptoms. You can have that as well. If that's happening to you, don't worry. It's just a stage, but make sure that you're looking after your nails. You're not biting them or, just make sure that you're going to go into the nail shop. Let them just kind of put some acrylics and just keep it there for a little while and then go back again after a while. Just keep it nice and clean, because after all, you have to look after yourself as well. Body odor changes. Body odor changes could be as a result of night sweats, and people begin to smell during this time. Make sure that you're putting some deodorants, so antiperspirants, sprays and roll-ons. Use those to make sure that you are not smelling. Although some women has been found to smell sweet, but some do not smell that way. So we have to look after ourselves. Okay, so I hope you've kind of got one or two things from today's show. So we've mentioned unexpected tears, increase in body hair, itchiness, incontinence, especially when you cough. Okay, so another thing that could happen is excessive thinking that things are worse as they are, which leads to depression, panic attacks and anxiety. So those are the symptoms. Make sure that you are aware of them. Memory loss, forgetting things, and your memory lapses. You might remember things that happened, and then things that happens after that you can't remember, and then things that happen the other way. At another time you do remember them. Difficulty concentrating, a huge one, and fatigue, feeling tired. You can't be bothered with things that you used to do. You can't do them anymore. Feeling of gloom, doom and gloom, apprehension feeling. Some of those things are menopausal symptoms as well. Irritability. You're irritated by things that didn't used to bother you so much before. And then, and weight gain. You add weight, and some people have been known to lose, but most people do, gain weight during menopausal symptoms. I don't know if you have had any other pain symptoms. Anyone else that have joined us? Yes, it does. Ayoba says, medically, how come women are already? I've answered that. Thank you so much, and thank you for everybody that has actually that have joined me today on Inspiring Time with Juliet, and hope we've kind of tackled the subject on menopause and its symptoms as much as you would like it to. If you have any question, any comments at all, drop it here on the comment box, and if there's any question, I can try and answer them for you. Okay, thank you so much. I've come to the end of this program, and I'll be with you again next week, where we'll be dealing with another topic that is quite inspiring. Like I said, you can always message me, inbox me, text me, whatever it is, or call on the number that is on the show if you have any suggestion, any topic you want us to treat, or any question at all. Thank you so much. Oh, Erin says, are women in menopause usually more wicked than their counterparts? Oh, they're perceived to be wicked because of the fact that they're probably not, they're irritated, not concentrating, they have a short-tempered because obviously they have all these things going on, their hormones just playing up, so it could be seen, but they're not wicked. It's just a phase that they're going through, and I tell you, they're going to be better afterwards. You just have to bear with them. Okay, thank you everybody that have joined me this afternoon. I hope that it is that everything is well with you, and that you have a wonderful week, and the Lord will bless you and bless your household as well. Have a wonderful week. Thank you for joining me. See you next week. Bye-bye now.